This is the Philips HeartStart manual defibrillator. In this organisation we have the Philips HeartStart manual defibrillator, and we also have the automatic external defibrillator, which you'll see on all the wards. When you go to an arrest in the wards, you should expect that the AED is already attached to the patient. You'll notice that they have pads connected. Now this pad cable can you can turn off the automatic defibrillator, unplug it and plug it directly into the manual defib for adult patients. For children, you need to actually replace these pads. Now looking at this device, you'll see that there's an off button. We have an AED function. We don't use this function here, we use our AEDs, our portable AEDs. However, this machine does have that facility. You'll also see the manual side of the dial, the manual part of the defibrillator. It gives you the joules here. It prompts you that it's 150 joules that you should be defibrillating with. If I turn it on, you'll see that the patient will actually be in VF. Just because of the noise, I'm going to turn the volume down so we can actually discuss a few other functions before we go further. But you'll see that we have the alarms, the heart rate alarms, if you were setting it, say, for monitoring, for example. You'll see the lead select. You'll see how it says pads. It's actually reading from the pads and giving you lead 2. Another way to actually monitor the patient, in addition to the pads, is by using the 3-lead cable. If you forget how to actually place it onto the patient, it has a diagram to prompt you. Connect the patient up. This will actually allow you to read lead 1, lead 2 and lead 3, and then it will go back to pads. If I was doing paddle defibrillation at this point, you'd see the word paddles there. Okay? In this organisation, it is our recommendation that you use pads as first-line treatment for defibrillation of all patients. Paddles are used as a secondary line. If we look at these functions on the right-hand side, we can see mark, which means you can actually mark an event on the rhythm strip. You can print a strip, the volume button, net summary, and you can also change the amplitude by going up and down with this button here. At this point, I'm actually going to demonstrate defibrillation. As I said, we would need to actually go up to 150 joules. You see at this point, number 2, see the word charge. I'm connected, so basically I'm going to charge to prepare to defibrillate. You can see the 150 joules are reached, which is what I've actually dialed up. At this point it's safety, stand clear, all clear, check that no one is touching the bed, do a good visual check. You'll notice number 3 says shock. Then I say I'm preparing to shock, stand clear, and then press number 3. At that point they've defibrillated the patient. This patient has just now gone into a junctional rhythm, and this once again gives us an opportunity to point out that it's telling me that it's 50 beats per minute, the current rate of this rhythm. You'll notice that there's no more shocking sign there. The charge just stays flashing in case I wanted to defibrillate again, which I don't in this rhythm. You'll also notice with the amplitude that I can actually increase the size of the R wave or decrease it. And this can help for interpretation. The other function of this defibrillator which I wanted to point out is pacing. You'll notice there's a pacer button, there's a start-stop button, there's a rate button, mode and output. If I turn on the pacer, you'll see it says pacer stopped. It will tell you that it's in demand mode of pacing. It will also tell you that it's going to rate as default setting at 70 beats per minute if I start it, and that the amplitude or the milliamps, the output will be 30. You'll also notice when by pressing the button pacer, I've actually got a dot on each R wave. This means that the machine's actually noticing that that's the person's own rhythm. To start pacing, it's very important not only to obviously press the pace button, but to press start. So when I do that, you'll notice that I'm actually getting a spike, but it's actually not in association with the patient's rhythm. It's actually not producing capture, we're not getting pace beats. So to actually get the patient to pace, you'd actually need to increase the output till you actually see pace beats. At this point, I can see that my output's up to 80, but you can see a pacing spike followed by a pacing beat. Externally pacing someone can be painful, so you may need to think about sedation for them. If you're having difficulty getting capture, you may want to look at your pad placement. It is fine to pace them with the standard pad placement. However, anterior-posterior is another possibility. The only other thing that I'd like to discuss on this defibrillator is the paddles. As I said, pad defibrillation is recommended in this organisation. However, say the cable fractures for some point and you actually need to swap from our pad defibrillation, which is what we've currently got connected, to paddles. Paddles are usually kept at the back of the machine and you can see the connection. The other time you might want to change these connections is in theatre when they've got internal paddles. You may need to actually remove, not even connect these paddles, but connect internal paddles. So once again, you'll need to disconnect the machine. So to do so, you'll need to turn it off. You'll notice the green part, it turns clockwise and then you remove it. And that removes the pad connection. You then have your paddle connection. You'll notice the pattern. It's the same pattern as here. You'll need to line up with this pattern. Once again, you need to twist the green part clockwise and line it up. It can be a bit fiddly. And click it in. Then you can turn the machine on again and you're ready to do paddle defibrillation.